Thank you very much, George. And I'd like to thank Andrew and all the organizers for giving me this privilege of joining all of you today. Can I have my first slide, please? Yes. So I'd like to share with you what we're doing in Singapore. We've launched a novel concept of called the Singapore Health District at Queenstown. Next slide. Next slide, please. And this is based. There was an excellent call by the United Nations and WHO in 2017 in the World Population Aging Report, which basically says, and I quote, as populations become increasingly aged, it's more important than ever that governments design innovative policies and public services, specifically targeted to older persons, addressing many issues such as housing, employment, healthcare, infrastructure, and social protection. Next slide. So if we really want to tackle healthy longevity, we need to look at what leads to premature disability and premature death. And up to 60% of the factors are actually social, behavioral, and environmental. Where I work in healthcare, I only impact 10% of the burden of disease unless I can really get out and prevent disease from happening. And about 30% are genetic factors. Next slide. So we basically said that we need a new narrative. And Professor Laura Carstensen from the Stanford Center of Longevity sums it up nicely when she says that the metric of whether we're successful is whether we can align health span with lifespan. As George mentioned, it's no point living long unless we live healthily and well. So how we live, learn, work, and play actually really matters. And there's a great paper which came out in 2018 in the Proceedings of the National Academy of Sciences from the Aging Society, which says that there are 5 domains that need to be addressed in the 21st century: well-being, productivity and engagement, security, equity, and cohesion. So we really need a whole of society and whole of government effort. And we've postulated that if we can identify a real world location-based platform where we can bring all the players together to co-create solutions which are both scalable and ultimately sustainable, we would like to tackle 4 areas. Can we increase healthy longevity? Can we enable purposeful longevity? Can we promote intergenerational bonding? And can we support a community for all ages to allow people to age in place? Next slide. So we've adopted one township in Singapore with the demographics that Singapore will face in 10 years' time in 2030. It's close to 100,000 persons. 25%, or close to 25% are already aged over 60 and over. 80% stay in public housing. And what we want to do is work with the agencies as we redevelop this estate, see whether we can impact those 4 domains. Next slide. So how are we thinking about success? Well, we're taking the aging index and the 5 domains, and we're seeing whether we can bring this down to the township level and then to the individual level. Next slide. And for this to be scalable across the whole of Singapore, it has to be sustainable. It must be tangible and resonate with the residents. Policymakers must find it actionable, and hopefully this is of value to the rest of the world. Next slide. So there are going to be 6 domains that we're working in. Firstly, preventive health and care delivery, aspects of purposeful longevity, the physical environment in planning and design. How do we bring technology into this? Communications and engagement to win the hearts and minds of residents, and ultimately evaluation whether we're on the right track. Next slide. So we've assembled a steering committee. It's co-chaired by the National University Health System, the National University of Singapore, and the Housing and Development Board. And the Housing and Development Board is unique in that it houses 80% of Singapore's population. It's a government agency. And the National University of Singapore has all the disciplines. It's a comprehensive university. And the National University Health System provides everything from prevention to end of life. We have agencies from the Ministry of Health, the Ministry of National Development, the Ministry of Social and Family Development, the Ministry of Culture, Community and Youth, and very importantly, the Singapore Business Federation, and one of the biggest private foundations, the Tsao Foundation, all as members of our steering committee. Next slide. Where did we get inspiration from? Well, there's a fascinating township in Japan, about maybe 15 to 20 kilometers from downtown Tokyo, called Kashiwa City. Professor Hiroko Akiyama was one of the main drivers behind this. And this gave us the idea that we could really bring a whole of society effort to address this issue of how do we enable healthy longevity. And I'll be glad to talk about this later on. Next slide. So in conclusion, we can only benefit from our increased lifespan if we have good health. We need to address all the determinants of health. It's just not the purview of the Ministry of Health alone. We have to tackle social, economic, environmental, and structural issues. And robust societies need to address the 5 domains of well-being, productivity and engagement, security, equity, and cohesion, especially as the populations age. And this requires a whole of government and whole of society effort. Thank you very much.
John, some really inspiring sort of comments there, but also a real call to action about that whole of society, whole of government piece. So I'm sure we'll pick that up. I'm hoping Alana will now be able to join us. I know she's had a few connectivity problems. Brilliant. Welcome back.
Thank you very much.
And please lead off.
Thank you very much. It's always very inspiring to listen to Singapore, I think. They really show very comprehensive examples of what we can do. So, I mean, George, as you said in the beginning, we have been successful at adding years to life. We have been, unfortunately, much less successful globally at enabling people to experience those extra years in good health. And obviously, we see incredible and unacceptable variations both within and across countries. So I'm thinking globally. So, I mean, really healthy aging has to be the new health priority globally. And the United Nations General Assembly responded by declaring 2021, so this year, up until 2030, the end of the Sustainable Development Goals, the decade of healthy aging. And so that's really intended as 10 years of concerted and catalytic action that if we put in place the right policies and the right systems, we can both add life to years and really improve the lives of current and future generations of older people, their families and their communities. And I think the decade's a really exciting initiative because it brings together 3 things. So a political commitment with a plan, a platform for knowledge exchange, and we just heard from John a good example, and a global collaboration. So, you know, one thing, the decade, with 3 aspects. The plan, so member states, including the UK, endorsed the decade, which covers 4 priorities. Governments felt that if we did 4 things, we could foster healthy aging. Change how we think, feel and act towards aging, deliver person-centered and integrated care and primary health care that's responsive to older people, make sure that those older people that need long-term care get access to it, and ensure that the communities actually foster the abilities of older people as they age and into older age. And that these actions are supported by enablers. The fact that you need, you know, the voice of older people, their families and their communities, you need to engage them in that process. We need to build leadership and capacity. We need to connect across sectors and stakeholders. And lastly, which, you know, speaks well to this audience today, is that we need data research and innovation to drive that. So the second exciting aspect of the initiative is really around a knowledge exchange platform. So we have a multilingual knowledge exchange platform. which was developed with inputs from 80 stakeholders in 80 countries. And that's really intended so that stakeholders can both find the knowledge that they need, but share the knowledge that they had. And we heard from John being inspired by Japan. It's a real opportunity to learn from others and exchange. The third is this global collaboration. John said it as well. We recognize that the challenges that face our society can't be solved by one sector or one stakeholder group. So, and that's why the decade was always intended as a global collaboration that brings together government, civil society, academics, researcher, private sector, media practitioners, really to try and add life to years. So together, the decade, the plan, the platform, and the collaboration, if we can address inequities in what we do, can enable older people to age safely in a place that is right for them, hopefully be free from poverty, and continue to develop personally and contribute to their communities while maintaining their health and autonomy. That said, and I think that this is why today's conversation is a particularly useful one, an incredible challenge exists in terms of how to make the case for government action to go from an investment as a to move from a nice to do to a necessity. And I think that's our real challenge at the moment. Moral imperative, and governments have all signed on to this, the UK and another 193, is not going to generate the legal or fiscal change that's actually required to deliver longer and healthy lives. So I look forward to this conversation.
Alana, and that's probably the perfect lineup for bringing in Andrew Scott. And Andrew, I know your work has been suggesting it's not just a moral imperative that Alana's been talking about. It makes economic sense too, and particular strategies make, if you like, more sense than others. So lovely to hear a bit more about your work.
Sure, and my goodness, it's inspiring and following. The things are happening, aren't they? Just really exciting. So fantastic to feel this agenda gaining momentum. And, I've been asked to talk particularly about some recent work I did with Martin Ellison at Oxford University and David Sinclair at Harvard Medical School. And one of the reasons I love longevity is the breadth of issues it covers. I mean, it's just intellectually fascinating, which of course is why John's absolutely right. This is about the whole of society in terms of whole of policy that is needed to respond to it. But as an economist, I'm particularly interested, of course, in the economic side. And I also think it's going to be key to really getting this agenda listened to by governments. It's about getting the ministries of finance and central banks behind that. And for me, there's sort of two ways, I think, as an economist about that. One is, how does healthy longevity play into stronger GDP? That's a complicated question. I'm working on it. I haven't got any quick answers. But the other one is to use the tools that we have in economics to value different types of health gains. And that's really what this work, the paper with Martin and David, focuses on. And, health is incredibly valuable. We've seen that just this last couple of years as governments around the world have introduced policies that have crashed GDP growth in order to save lives. So, what we got in economics is the tools to put a value on health gains. Now, one of the great things about economics and the terrible thing about economics is it puts a price on everything. And there's that wonderful quote by Oscar Wilde that a cynic is someone who knows the price of everything and the value of nothing. And that could apply that to sort of economics. And if you don't like putting price on things, then you don't like economic analysis. We know health is important. But what we can do is use our tools to say, okay, how much is this worth compared to something else? And of course, that's the essence of budgeting. And it's what NICE does in the UK. We'll spend this amount of money if it can generate this much of sort of healthy improvements. And what I focus on is this concept called the value of statistical life. And this is a concept used across a range of different policies by different governments. And let's say a value of statistical life is worth 10 million. If you can take an action that reduces your mortality risk by 10%, if the value of a statistical life is 10 million, then it's worth $1 million. That's just a simple idea. What this is actually valuing life itself. That's you can't put a number on taking away my existence, but you can play around with probabilities. And what this value of statistical life does is sort of say, well, let me think about welfare in 2 dimensions. One is the quantity of my life. Time is important. So how long do I live for? And the other is quality. And of course, quality is very multidimensional, and to make it manageable, we're going to boil it down. But really, there's 2 strands to that in the model. One is around our health, and the other is about our standard of living as captured by our consumption and our leisure. And what, built on all sorts of assumptions that you need to come up with numbers, but it says, let's imagine, we, as a society, as individuals, we plan our lives based upon what we think our health is going to be and what we think our life expectancy is going to be. We look at wages, we look at interest rates, and we make decisions about savings, when we're going to work, when we're going to retire, consumption, etc. And, all of those will generate a number of value of a statistical life based on life expectancy, health, and your standard of living. And if you change your life expectancy, if you change your health, people will make different decisions, and that will lead to a different number for the value of a statistical life. And so what you can do is look at 2 different scenarios, see how people change their behaviors under certain assumptions. This is theoretical, and then calculate 2 different values of statistical life. And the gap between them is what's called a willingness to pay. How much is this improvement worth to us as an individual? And it's really important. This is not about how much I earn. This is not about income. This goes back to saying, we're happy to see GDP fall because it keeps us healthy. This is simply how valuable is our health to us. It's using economic tools to place a value on that. Now, in this model, we play around with all sorts of different scenarios. So one we look at, we call Strudberg, after Gulliver's Travels, with Jonathan Swift, is one where people live longer, but their health doesn't improve. Health still declines with age. So you get the increase in life expectancy, but it's an ever-diminishing health. Another one we look at is called Dorian Gray, which is the very opposite, after the Oscar Wilde novel, where you don't change people's life expectancy, but you improve their health at every age. So we're aging more healthily, health, almost pure healthy longevity. Then there's another one we look at called Peter Pan, and Peter Pan says, okay, well, we know mortality risk rises with age, and we know that disease burden rises with age. What if it's triggered by a common thing, aging? And if we could slow down the rate at which we age, if we can age better, then we're going to live for longer and get better health. So you get the 2 together. And then if you look at the more radical scientific innovations that people are proposing, we have a final one from the pages of graphic novels, Wolverine, which is where you can literally reverse biological age. You can sort of replace your liver and your heart and you're young again. All very theoretical, but 4 clear case studies. Now, I won't go into intricacies, but the results, if you sort of go through the standard economic analysis, here's just a few of the headlines. You probably won't be surprised. It's enormously valuable. Or any of these scenarios are enormously valuable. The second is that increasing life expectancy is good. We like longer lives according to the model, but at a diminishing rate because you're in poor health. And so if you switch to the Dorian Gray case where you're increasing healthy life expectancy but keeping life expectancy the same, so you're compressing morbidity, it's incredibly valuable. It's much more valuable than just another year of life. In fact, our results show that a full compression of morbidity for health span to equal lifespan is much more valuable than seeking further gains to life expectancy right now. Absolutely echoing everything that's been said. We then look at the Peter Pan one, which is this one where you're slowing down how you age, you're aging better. And there's this notion that aging is malleable. And of course, if you look at inequalities in society, we know that aging is malleable. We know that mortality and health vary enormously with socioeconomic circumstances. What's interesting about that Peter Pan one is, of course, you get the best of both worlds. You get both longer life and better health. But there's an interplay between those 2, which is really, really important for sort of some of the insights. The longer we live, the more we value better health. And the longer we're healthier, the more we value longer life. And so that Peter Pan one actually gives very, very large numbers. We also look at sort of if you could improve how you age, and I'm not just talking here about scientific methods. I'm talking about some of the things that John has been talking about, Alana, things like education, the environment. All these things seem to improve how we age. You sort of get big numbers compared to just treating single diseases like cancer or cardiovascular. And the reason why healthy aging has these big effects is perhaps obvious, but it's stunning to see the size of the effects in the calculations. One is, of course, if you can improve how we age, you impact lots of age-related diseases. So you're summing across lots of diseases rather than just tackling one. The other thing, of course, is that if you could make, and we have made progress with cancer and we have made progress with cardiovascular, but there's still other diseases around. Whereas if you can improve how you age and reduce the incidence of all those diseases, you increase the quality of the life that you gain. So you get this huge impact by tackling the causes of aging directly. The other thing was, I said the numbers were big. When you aggregate across lots of people, you get very big numbers. So we calculate if you could improve how you age by adding another year of life, for the US economy, it's worth something like $37 trillion, which on an annual basis works out at about 3.5% of GDP. So, there's some of the results, and I just sort of try and sort of step back from the results and sort of give some of the insights that drive it when you look at the mechanisms at work. First, I want to stress that I say this is not just about health interventions. This is any socioeconomic intervention that will help you age better. The second thing that, if you look at the numbers, what's driving this, it's actually very clear. There's a lot of talk about an aging society and there being more old people than young people. But when you look at these sort of calculations, what you notice is that actually the real change that's happened is the young can now expect to become old. It's not that there's more old, it's just that the young should now expect to become old. And of course, when you say to people, how do you feel about that? They worry. They worry about end of life because we've pushed so many of these diseases now to later life. You said at the beginning, George, longer life used to be a metric of health. It no longer is. So if the young will become old, if the big fear is these age-related diseases, you can see that there is this huge value in tackling age-related diseases in healthy aging. And for most of human history, the young haven't expected to become old. It's always been a minority, not a majority. And in many, many countries now, it's the majority. So, of course, that creates a new health imperative, which is to age well. It really is all's well that ages well. So this is simply about what it's worth to us as individuals. I mean, I'll go back to my role as an economist. I still think we should be searching for a three-dimensional longevity dividend: life expectancy, health, and how we can boost the economy through that. But health itself is incredibly important. The biggest challenge we face in this new world of humanity is the young will become old. Aging well is critical.
Andrew, fascinating logic. And it really sort of comes back to what we started trying to do in the UK some 4 or 5 years ago, which is a government ambition to add 5 extra years of healthy, independent life, actually in quite a short time frame, by 2035. I want to sort of start by probably actually posing John a question, and particularly given that part of your role is health innovation and translation. And so we have this conundrum of where do you start? And it would be fascinating to understand how you chose Queenstown and a community of about 100,000 people to get started, and what we can learn from that in terms of approaches to implementation of age-friendly communities right across, not just the UK, but more globally as well.
Well, thanks, George. I think Queenstown was chosen because it has the demographics of Singapore in 2030. It's one of our it's one of our oldest townships, and so we wanted to choose a real-world location. So, close to 1/4 are currently over the age of 60, and Singapore, the whole of Singapore, is going to be in that way by the end of this decade, and 80%, so 80, stay in public housing. And so this is very important, both from the socioeconomic status as well as from the demographic status. So that was, and certainly Singapore has a burning platform. We're one of the fastest. We're one country or one city-state where the proportion of older people is going up significantly, and it really is in our interests to see how we can increase. Currently, Singapore health-adjusted life expectancy is about 75. Life expectancy is 85, and having the last 10 years of one's life with poor health, to me, is unacceptable. And we know that many of the factors that impact health are actionable. So yes, we know a lot of knowledge about prevention, but the issue is last mile implementation. So in Singapore, the statistics on screening are still, 1/3 of the population still declines to go for age-appropriate interval, at the intervals recommended by the Ministry of Health for diabetes, hypertension, and hyperlipidemia screening. Again, that's really, unacceptable. Half the population do not go for their regular mammograms and colon cancer screening, and again, that's unacceptable. So we have knowledge. What we need to do is actually implement it and get down to the last mile of the last mile. We know that when we did a survey of Queenstown before we started this whole program, the number one issue affecting well-being was loneliness. So we said we have to tackle issues of loneliness, and that's why the purposeful longevity work stream started. People need to have a reason to get up and get out of bed. And so we need to relook at issues of health-adjusted life expectancy according to occupation and income group, because we do need to relook at issues of retirement, and Singapore is doing that. We need to look at issues of volunteerism. How can we get people to volunteer more, because it's good for the health, it's good for the community, and it benefits everyone. And then how do we really tackle issues of education? We all talk about lifelong education, but how do you really come up with programs whereby people in their 40s and 50s and 60s and 70s and their 80s can continue to enjoy learning? And I think we know a lot about learning in children and adolescents. I don't think we know enough about the science of education in older people. And then we need to design the built environment to enable this. And then finally, this issue of technology. I think if we want to co-create the technology with residents, because people always say that older people are not tech savvy. Well, I think they're not tech savvy partly because it wasn't co-designed with them. We find that if we actually work with residents and design technology with them that meet their needs, adoption and uptake are much, much higher. And so these are all very important streams that we want to address. Over.
No, interesting. And we might come back to the economics of businesses working with populations and developing things. I want to I think pick up on a theme that John has sort of just introduced, and Anna Dixon has sort of put in a question asking about what are the economic benefits of healthy aging at older ages when people have stopped paid work? Is there an investment case for better social care? I think from our own perspective, we'd also sort of say that there are broader sort of benefits for all forms of work in later life individually, but economically, what have you seen, Ilana? And are there some good examples from the age-friendly communities that you might be able to point us to?
Thanks, George, and thanks, Anna, and great to see you pop up, at least on the chat there. So yeah, I mean, there is a strong economic case for investing in long-term care. I mean, partly in the sense for older people being able to live dignified lives, I think, but also reducing unnecessary hospital admissions and the associated costs, investing in social care such that we're reducing out-of-pocket payments. I'm thinking globally, in terms of both older people and their families, the potential for improved end-of-life care, obviously the case for enhanced employment in long-term care, and increased innovation and commerce in long-term care. So I think that there are lots of, I can't put a figure on that, but maybe Andrew can help us with that one. But there are certainly a lot of aspects that make the case for investing in social care. And clearly, I think that's one of the strengths of the age-friendly cities and community approach globally, in the sense that age-friendly communities are orientated at responding flexibly to the needs of the local populations. So whether that be in promoting health and maintaining health across the life course, or responding to those who have declines in physical and mental health. And I think, we see, some really interesting examples. I mean, even in terms of long-term care, there's a really nice example in the Ville de Charleroi in Belgium, for example, that with very minimal investments in, okay, I can think of it in French, but basically where they put in a téléviseur, a system whereby you could, older people could communicate with somebody, which meant that if they were having a fall or anything happened, they could communicate, they could get emergency services very quickly, but they were able to remain in their homes for longer. And I think they were paying it something like $40 euros per year to have access to this service, which had huge benefits in terms of enabling people to age in the place that they wanted to, while managing and responding to any risks or changes in need. So, I mean, there's a lot of examples around the world where they've been able to respond to people's long-term care needs using local, responses.
I love it. And Andrew, I don't know if you wanted to come in on the economic question that Alana raised.
Yeah, I haven't got any sort of numbers to sort of pull out of the hat right now, but I mean, I think I'm always keen to sort of stress two different things. I think there is a healthy longevity economic dividend. Right now, lots of people withdraw from the labour force from 50 plus. And that's a problem, because if we're living longer lives, we need more resources. So how we keep people working for longer from 50 plus who can and want to is really important. And that's about education. It's about health. It's also making sure they've got flexible work so they can care for family and relatives. And, there's certainly a GDP boost to have from that. And I think that's something that's just ignored by most ministers of finance. But some things are just important. They don't have to be instrumentalists for GDP. And I think when it comes to sort of caring for people at the end of life in poor health, we just know health is incredibly valuable. I just go back to this, what we've learned from COVID. And I know it's not sort of the easiest thing in the world to sort of go to Ministry of Finance and say, this is incredibly valuable. But economics isn't about all that's good for the economy. Most of the things we value highly exist outside of the economy. I think the challenge we've got is actually it's expensive. And I don't think many governments, they think it's not valuable. They just say it's expensive. So how can I find a better way of doing it that's cheaper? And I think that's probably the better way of bringing finances in. But it's clearly one incredibly important to us individually and as a family. And I think obviously the more we have older people in that situation, the more it's also going to become a political pressure. I think for me, the other challenge is that often the people who are in most need of care are the voices that aren't heard the most. And that makes it then harder to feed into the political process.
There's a great question from Andrew Larpent about multimorbidity. I'm going to sort of take this as a slightly broader sort of question. And John, I think particularly for you, I'm guessing that the genesis of the WHO's decade of healthy aging was before the pandemic, when we were all thinking that infectious diseases were a thing of the past and non-communicable diseases were the challenge we face. We now face both. Looking specifically at where you're focused, how has the pandemic and thinking about infectious diseases going forward changed your approach to the work on raising sort of healthy life expectancy?
Well, I mean, I think in the acute issues of the pandemic, it's more than just a health issue. So we have to look at issues of the whole built environment. How do we make the built environment even safer to try and, because in Singapore it's a very dense city, and so how do we address issues of urban density? How do we relook at public transport? How do we look at air circulation? So there are a lot of issues that we have to address from the pandemic viewpoint. It's also brought up issues of the economy, because if people lose their jobs in their 40s and 50s, it's very hard, it becomes very challenging to re-enter the workforce. And I think the government recognized this very early on. So they came in with very aggressive packages to employers to allow them to continue carrying their employees, even though through the difficult, the last 2 years that we have had. So they've called it the job support scheme. And so therefore, Singapore's unemployment rate has basically still remained at around 3%, 4%. And then finally, one has to look at issues of how powerful and how important digital technology is. And so one calls this almost a super social determinant. Whether you have access to good broadband affects everything from home-based learning, because actually I'm very worried about the effects on education. For the last 2 years, the fact that if you don't have good broadband access, the ability to learn at home is greatly compromised. Everything, so from education to teleconsultations to being able to order your groceries. I think that the pandemic has highlighted many structural issues, and finally, many social issues, because it's always the precariat which are most affected in any any public health emergency. It's the precariat that's affected, and ultimately, whether you're from the bottom decile of the economy or from the top decile of the economy, it's still the same ICU bed, and it's the same emergency room that everyone converges onto. So we really need to make sure that the entire population is healthy and resilient, because if we don't, I mean, it's then you have the terrible issue of how to deal with triage, and triage should never be based on social issues. Over.
Alana, do you want to sort of come in?
Yeah, thanks, George. I mean, I think one of the things that's really essential also is to move away from treating single diseases to what Andrew was talking about, was actually trying to look at more integrated approaches and addressing people's levels of functioning. So if we don't, and it's one of the priorities that governments recognize is really important, is that we need integrated care, looking at people's physical and mental capacities. And we know that that has huge benefits in terms of, lowering hospital visits, increasing, reducing the time people spend in hospitals, reducing the time people might have to wait if they do need to go into long-term care or other services. So we need to move away from looking at people as buckets of diseases and try and start treating them as individuals with a single comprehensive assessment, a single plan, and providing integrated care. And that's really important if we're going to really change the paradigm around health in older age.
And I'm going to ask one sort of probably final question, which was posed by Alistair McQueen, which I think is a question of the moment, if you like. And that's, can those who promote the needs of aging learn from those who promote the needs of the environment? So in his words, what's happening is stopping us having a COP, if you like, for aging. I think I would possibly sort of phrase that, can sustainable aging be a core part of sustainable societies altogether? So how do we bring sustainability into this? Open question. Anyone want to lead off?
Well, I'd take a stab at it. I mean, there's two things. There's how you integrate it into the sustainability agenda. And of course, if people are living for longer lives, then the environment is going to have a huge impact on their health. So there's a definite connection there. I think also people take a longer term perspective, which hopefully affects the sustainability agenda. And so I think there is an important link. And of course, given the number of people on the planet, we each individually have to make sure we live a sustainable life to support the number that's going to be rising because of people living for longer. I think then there's the sort of, how do we actually learn from the public campaign? And I guess unfortunately, the biggest thing to learn is patience. It's sort of drip, 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 repeat. I don't think there's going to be a moment where it suddenly all bursts out. Obviously, as the numbers of people increase, this issue is going to become more and more pressing. I think, as with the environment now, we want to make sure that we act before the numbers become big. We want to make sure people who are young and middle-aged become healthy and not just look after the old right now. I think that's the challenge, but it is, I'm afraid, I think, just constant drip, drip.
But George, I think one other way of looking at this is that very often in climate change, individuals say, well, what does my effort deal when other countries are responsible for climate change? So unlike climate change, healthy longevity is something which we all can do. We all actually can be masters of our own communities, our own societies, our own families. And I think that we can actually have a greater chance of shifting the needle for healthy longevity at a personal and at a community level than perhaps the whole issue of climate change. And that may be one dimension which we haven't really exploited. And I think that what we do need, and this is something we're trying to do in Singapore, is to have every policy seen through the lens of healthy longevity, just like every policy is seen through the lens of the environment. Because the two historic changes that are going to occur in our lifetime are climate change and demographic change. And there's no playbook for this. So, I think that this is something that we do need to work on because no one's going to do it for us. Over.
Yeah.
No, sorry, Ilan, did you want to come in?
No, I mean, I think it's, it's not an either or, isn't it? We need to address both people and planet. Yeah. And I think the intention of the decade is really in line with the Sustainable Development Goals and Agenda 2030, is how can we ensure in our efforts to have, the world we want and a more sustainable world, how can we ensure that older people do not get left behind in that process? And I mean, that means even at community level, what do you do around ambient housing? What do you do around transportation? So, looking at it both from older person's perspective and the issues around climate has to be, as John said, something that's considered in everything we do.
Good. And I warned you that I was going to ask you a closing question. And I think actually listening to what you've been saying, that the question might be unfair, but I'm still going to ask it to see how you respond, which is, what's the one change you would want to see that will make the biggest difference in promoting healthy aging? Andrew, I don't know if you want to lead off. You're on mute.
Of course, it's everything. John said it's about the whole of society, whole of policy. So what is the one thing I'm going to say? People focus on what's a target. I think we need to elevate healthy life expectancy as an absolute key target. We focus on GDP and lots of things. Healthy life expectancy is key. And I think that should be the center of a really big new public health. I'm bringing a second thing now. Public health focus. As John has said, it's about the environment we live in. It's about everything we do. It's about how we walk, how we move. It's about work, learning. That is a new public health agenda from 50 plus onwards. We did it brilliantly for infant years and used it to reduce inequality. We need to do the same from 50 plus.
Lana, do you want to?
Yeah, I mean, I think there's something that we haven't talked about, George, which is a real barrier, and that's how we think and feel and act towards age and aging. And so I believe that if we can, one change would be having a much more positive attitude towards age and aging. And I think if we can tackle ageism as individuals and in terms of society, then we can think much more creatively about the second half of life than we currently do now. And we're much more likely to come up with useful innovations which foster both longer and healthier lives.
And then John, do you?
So George, this is perfect because I fully agree about health span and ageism, but I would like to make a call to address all the social determinants of health and equity, because it's going to be that part of society which struggles the most. Thank you.
I think that's a wonderful way to finish. So thank you all three. I mean, John, I think you illustrated so clearly why 60% of the outcomes are social, behavioural and environmental, and we need to think about the research there. Alana, it's wonderful to hear about, the age-friendly communities and building a movement, if you like, from bottom up rather than trying to be top down. But then, Andrew, to cap it with what you said, actually to focus on what that end goal is, that actually healthy life expectancy is the thing that we should be measuring, reporting and aiming for. So thank you all for a fabulous panel. It's actually been a great continuity through the day. We've heard so much on similar sorts of themes. So you've really helped cap off the first day of our conference. Thank you very much.